everyone. My today's topic, Shigellosis or dysentery, bacterial dysentery. Dysentery or Shigellosis is the most acute intestinal infection diseases and characterized by general intoxication and colonic dysfunction. Etiology, this is Shigella, the causative agent belongs to the genus Shigella and family Enterobacteriaceae. There are four types of Shigella: Shigellosis, Shigella dysentery, Shigella flexneri, Shigella boydii, and Shigella zonlei. Shigella facultative anaerobe and are gram-negative and have no spores and capsules, and none are known mold. Epidemiology, the main sign of disease is a patient with acute and chronic dysentery and bacterial carriage of the bacteria. And the disease is transmitted through contaminated water and food and household contact routes, and the disease mechanism of transmission. The transmission is fecal oral. And the disease may be transmission of vegetable and dirty hands. And the disease can be contaminated with children, and clinical signs. The clinical classification is as follows: acute infection, acute shigellosis, chronic shigellosis, and carriage bacteria. And acute shigellosis itself divided into three groups. And colitic form, gastroenteric form, and gastroenterocolitic form. And acute form, the disease begins with the patient complains of the pain and headache, and fever, and sometimes the disease begins suddenly with fever and high fever and headache. And the acute form, colonic form of the disease is the most typical, and it is characterized by an acute onset and toxic syndrome and distal colitic syndrome, such as the pain in the left iliac area, and blood with mucus and mucus and false feeling of acidification need. The main symptoms of the disease is hardening and thickening in the large intestine, and especially the S-shaped intestine. The severe forms of the disease, more severe begins more severe symptoms. The patient complains of headache, fever, dizziness, and sometimes vomiting, and observed from the first hours, and soon abdominal pain and the diarrhea join these symptoms, and admixture of blood and mucus is determined. And the abdomen becomes painful on palpation, and the patient skin turns pale and covered with cold sweat, and pulse quickens, and the blood pressure drops significantly, and occurs collapse. Complications of Shigellosis include the rectal and rarely intestinal perforation, and peritonitis, and peritonitis, bleeding, and sometimes otite and pneumonia. Diagnosis of the disease, the exact diagnosis is made based on clinical symptoms and epidemiological data, and coprocitogram. It is macroscopic examination and of a smear from feces. Under microscope is found leukocytes, erythrocytes, and mucus. And in bacteriological examination, the feces are cultured and cultured on artificial nutrient media, and rectal ramaloscopy or colonoscopy examination is widely used. The exact diagnosis dysentery or differential diagnosis of dysentery, and treatment, etitropic treatment is performed by the in mild forms of dysentery, and the patient are given antihistamines and vitamin B, C, and diet therapy. And the severe case, the treatment, the patient immediately hospitalized and should be plenty of fluid and the severe case are given antibiotics such as levocetins, ampicillin, and drug talazole, and the patients are intravenous injected, dissolve, cresol, and saline solution, and prevention of the disease include the early detection early detection patient, and adherence to personal hygiene, and prepare storage food products, and medical supervision control of the water. I am finished. Thank you for the attention.